The skeletal system. The skeletal system provides a framework of stiff levers and stable plates that permits a multitude of movements. Skeleton also integrates functionally with the cardiovascular system, as every second, millions of fresh blood cells pour out of the bone marrow. The skeletal system works as a support structure for your body. Without the skeletal system, our body would be a lump of meat with skin. It gives the body its shape, allows the movement, makes blood cells, and provides protection for organs and stores minerals. The skeletal system is also called as the musculoskeletal system. Why skeletal system is also known as musculoskeletal system. The musculoskeletal system is an organ system consisting of specialized tissues of the bones and skeletal system and skeletal muscles. In the musculoskeletal system, the muscular and skeletal systems work together to support and move the body. The bones of the skeletal system serve to protect the body's organs and support the weight of the body, while the muscles of the muscular system allows movement for the body. Some facts about the human skeleton. The skeleton makes up almost one fifth of a healthy body's weight. It also protects certain organs such as the delicate brain inside the skull. It can repair itself if damaged and can be remolded its bones to thicken and strengthen them. The baby's bones has about 300 bones at birth, then eventually fuse to form the 206 bones that adults have. The parts of the skeletal system include the bones or the skeleton, joints, cartilages, and ligaments. The ligaments are bands of dense and fibrous connective tissue that are key to the function of joints. But ligaments and joints work together. Then cartilage is a more flexible than bone but stiffer than muscle. It helps give structure to the larynx and nose. It is also found between the vertebrae and at the ends of the bones like femur. Joints. The part of the body where two or more bones meet to allow movement. Some joints have a slight movement like the distal joints between the tibia and fibula. Joints that allow a lot of motion are the wrist, shoulder, hip, and ankle bones, which are located in the upper and lower limbs. The skeletal system is divided into two divisions, the axial skeleton and the appendicular skeleton. The axial skeleton are the bones within the central core of your body. These bones include the ribs, skull, and the vertebra, while the appendicular skeleton are the portion of the skeleton of vertebrates consisting of the bones that support the appendages, examples of which are the bones in the pelvis and the extremities. The extremities are the bones in the upper limb, bones from both shoulders to hand, and lower limb, bones from the pelvic to both legs to foot. The extremities are composed of 126 bones.
Functions of bones. 1. To support the body. 2. Protection of soft organs. 3. Movement due to attached skeletal muscle. 4. Storage of minerals and fats. And 5th, blood cell formation.
Classification of bones. Bones are classified according to their shape. There are 5 types of bones, namely long bone, short bone, flat bones, irregular bones, and lastly, sesamoid bones. The first type of bones that I will discuss is long bones. Next. Illustration mapping The different components of a long bone. The bones of the body come in a variety of size and shapes. The four principal types of bones are long bones, short bones, flat bones, and irregular bones. Bones that are longer than they are wide are called long bones. They consist of a long shaft with two bulky ends or extremities. They are primarily compact bone, but may have a large amount of spongy bone at the ends or extremities. Long bones include bones of the thigh, leg, arm, and forearm. Next. There are 9 types of long bones. The first one is femur. The femur is the longest and strongest bone in our body. We can find the femur in our thigh. The next one is fibula. The fibula is your calf bone. It's the smaller of the two bones in your lower leg. It gives your calf its structure and forms the top of your ankle. It is found in the back of our leg. Tibia is the shin bone, the larger of the two bones in the lower leg. The top of the tibia connects to the knee joint, and the bottom connects to the ankle joint. It is found in the front of our leg. Metatarsal, the bones of the forefoot that connect the distal aspects of the cuneiform. Metacarpal, any of several tubular bones between the wrist bones and each of the forelimb digits inland vertebrates corresponding to the metatarsal bones of the foot. Phalanges, the 14 bones that are found in the fingers of each hand and also in the toes of each foot. Humerus, a long bone located in the upper arm between the shoulder joint and elbow joint. Radius, one of the two large bones of the forearm, the other being the ulna. Ulna, it forms the elbow joint with the humerus and also articulates with the radius both proximally and distally. Next. Short bones. Short bones are roughly cube-shaped with vertical and horizontal dimensions approximately equal. They consist primarily of spongy bone, which is covered by a thin layer of compact bone. Short bones include the bones of the wrist and ankles. Next. There are 2 types of short bones. Carpals. Carpals are bones of the wrist that connect the distal aspects of the radial and ulnar bones of the forearm to the bases of the 5 metacarpal bones of the hand. Tarsals, a cluster of 7 articulating bones in each foot situated between the lower end of the tibia and the fibula of the lower leg and the metatarsus.
Flat bones are made up of a layer of spongy bone between two thin layers or compact bones. Spongy or cancellous bones are lighter and less dense than compact bones. They have a flat shape, not rounded. Flat bones have marrow, but they do not have a bone marrow cavity. Flat bones serve to protect our internal organs such as the brain, heart, and pelvic organs, and can provide protection like a shield which also provides large areas of attachment or connection points for muscles. Examples include the skull or the cranial bone, which is surrounded even in the back of our head. Its function is to protect the brain, as our brain is really sensitive, which is really important to our whole body function. Next is the rib, in which flat bones protect our lungs with its unique shape. The sternum is located in the middle of our chest, which is also sometimes referred to as the breastbone. A partially T-shaped vertical bone that forms the anterior portion of the chest wall centrally, which protects the organs of the torso or the body from injury that connects the ribs via the costal cartilages forming the anterior rib cage and also serves as a connection point for other bones and muscles. Scapula, also called shoulder blade, which is an important bone in the function of the shoulder joint to be able to move on how it should be. Next po. Irregular bones. perform different functions in the human body by interacting with the muscles and tendons. They allow movement of the back and pelvis. These are any of the groups of bones that has peculiar or complex forms, such as the vertebrae. They often have a fairly complex shape which helps protect internal organs. For example, the vertebrae, irregular bones of the vertebral column, protect the spinal cord. The irregular bones of the pelvis protect the organs in the pelvic cavity.
Sesamoid bones, small round bones found in the tendon of the hands, knees, and feet, used to protect tendons from stress, relieve tension within muscle and tendons, allowing for increased weight, bearing, and tolerance force, protecting them from significant strain and injury. Patella is commonly referred to as the kneecap. Next po. Fracture is a partial or complete break in the bone. A stable fracture, bone that is broken but with minimal damage, causes overuse, trauma, osteoporosis. Transverse fracture, when your bone is broken perpendicular to its length. It causes car accidents. Oblique fracture, when your bone is broken at an angle, cause landing on your bone at angle, fall on a building.
Comminuted fracture. This type of fracture in which the bone shatters into several different pieces. From its term comminuted, a comminuted, which refers to a bone that is broken in at least two places. Comminuted fractures are caused by severe traumas like car accidents, on where surgery to repair your bone is needed. While transverse fracture, this fracture goes in the straight line across the bone, after when your bone is broken perpendicular to its length. This can happen to any bone in our body, but usually it affects longer bones after a trauma like a fall or accident. Examples of fractures were scanned through X-ray which seen in two-dimensional pictures. CT scan that is detailed slices or cross-section of the bone, and lastly, the MRI that is a very detailed image using strong magnetic field.